We're just going to talk Tim's going to describe the book and the project overall briefly, and then we're going to have a conversation about the issues it raises. So, I know I've interviewed you a lot of times. I don't want to bore you, but describe to me how this came about and how it changed as you were writing it.
Yeah, well, thank you, Zoe. Thank you for doing it. Thank you all for coming. It's wonderful to see so many people here. And it's also very fitting because the origins of this book actually happened here in this bookshop 15 years ago when Jonathan Sinclair Wilson, who is here somewhere, I think, yes, there he is, there is the man, who had published Prosperity Without Growth for EarthScan, as it then was, and we held the launch event here. And really the roots of the care economy go right back to Prosperity Without Growth. It's not a growth obsession, it's not really an obsession with ungrowth or degrowth, but it is a questioning of whether the growth-based model is the right model to deliver us relentless progress. Is it something that we can trust? Is it something that can guide us to safety? And the musings that I did at that time, 15 years or so ago, with the Sustainable Development Commission, led me to believe that actually maybe it's not, but that prosperity itself really does matter. That's something that matters. And that you get to the kind of question, well, if prosperity isn't income and growth and wealth, then what on earth is it? And sometime during that journey, it came, and it was partly from speaking to people about what they felt prosperity was. The idea, and it's nice that it rhymes, is that prosperity is more about health than it is about wealth. And that idea, when you talk to people, makes sense. It makes a lot of sense that, if your health goes missing, nothing else really matters. If the health of your family goes missing, nothing else really matters. If your kids are sick, if your parents are sick, if your community is dying, nothing else really counts as a kind of prosperity. So there is a sense to the idea that prosperity is something more like health than wealth. And then slowly over time, a few things happened. One of them, of course, was the pandemic. And during the pandemic, that lesson became quite obvious to many of us. And the idea that actually we needed the people that we largely denigrated, the people who were giving care, the people who were on the front line, the people who kept us from dying, the people who kept us alive. And for a long time, they had been suffering from very, very low wages. They'd been suffering from a sort of second or third class citizenship in which wealth went elsewhere. And if we're lucky, they got the proceeds of that wealth, what was left over, the crumbs from the table, went to the care workers if there was enough to go around. And at one point, we even applauded them on our doorsteps because that was absolutely in our minds, first and foremost, that care matters. And then, of course, it came to the post-pandemic years, the years in which actually it became clear that the people we applauded on our doorsteps were furiously underpaid, overworked, disregarded. And they put in a little bit of a claim on that goodwill and wanted some kind of pay rise. And after 2 years of wrangling, they were given a pay settlement. Nurses went on strike. For the first time in the history of the NHS, nurses went on strike. And they came out with a pay rise, which gave them a salary that was less than the rate of inflation and was still working at about 20% less wages than they had been working in real terms a decade or so before. That was the settlement for what we had learned through the pandemic, the idea that care really matters. Nonetheless, I had this very simple idea. Prosperity is health, economy is care. It is in some sense blindingly obvious. But the outcome of stories like that, and it was a little bit the journey of the book, was to make me realize that that is so blindingly obvious that the real book is not so much to state the blindingly obvious, but to ask why the blindingly obvious doesn't happen. And that's kind of what the book is. It's kind of what I do. It's a little bit of a journey. It's a journey that I'm sort of personally involved in, actually for health reasons, but that's not the main point of the book. The book is actually a kind of an exploration. It's a kind of journey through that puzzle about the most important thing, the foundation. You can think of care, and I present it in the book as a kind of foundation for the organization of organic life. And yet we disregard it in the economy the whole time. And so it's a journey through the reasons why that's the case, what we might do about it, and what it would look like if we took care as an organizational principle for social and economic life.
I mean, since you finished this book, and indeed since the copies arrived, we've got a new political wind, which explicitly recasts or casts care and disability and chronic illness as a drain on society. Do you see any way out of the kind of narrative trap of that?
Yeah, I mean, I think in a way that's kind of what I'm searching for in the book. I'm kind of searching for what is that narrative, and the one that I start with, I suppose, is the wisdom of the body. The Wisdom of the Body is the title of a book by Walter Cannon, written in 1932. And it builds on the beginnings of physiological science. It builds on the idea, actually, that we have a kind of inbuilt mechanism towards health, that the body returns itself to health. And actually, it's constantly at attention in returning us to health. It has what's sometimes been called the restorative power of nature, which actually lives within us. And almost anything you think about when you think about the human body is subject to that restorative force on a continual basis. So the heart rate, your temperature, blood glucose, dopamine are all subject to a process which brings them back into health, into a dynamic balance. And the thing, when you begin to think of it in those terms, is that health is about balance. And the thing that really upsets balance is the constant attention to growth, the constant attention to more and more. So take something like blood glucose, for example. You know, we live in an obesogenic society in which we're surrounded by things which have far too much blood glucose for the health of the human body. And when you think about that in terms of individual illness, diabetes, let's say, you kind of think, well, here's a patient exhibiting high blood glucose and the signs of some early signs of diabetes. And so the right thing to do is either to give them a pill or to ask them to change their life a little bit. And then they go out and try to change their life a little bit. And you find how desperately hard that is because the entire environment is glucosogenic. We're living in a big food system, which is a huge false economy, as I pointed out for the Food Farming Countryside Commission. David, thank you for coming tonight. A few weeks ago, that the cost of chronic disease is largely from food and lifestyle, and getting that food and that lifestyle wrong is a staggering 268 billion every year in the UK. That's more than the NHS bill, it's more than the entire spending on health, and yet it's being incurred in terms of people's health, the needs in the health system, the welfare that they need in order to be able to go on live, and nothing is done about the obesogenic environment. Nothing is done about big food, making it absolute necessity that you eat with engineered calories, which have basically had all nutrition taken out of them and end up getting sick as a result of it. Nothing is done about the power of big business. And that's one of the problems is, of course, that it's two big businesses. One is big food and the other is big pharma. Because if you can persuade people that a pill will fix their underlying problem and never actually address the causes of that problem, just fix the symptoms of it temporarily, then you can get growth in both industries. And so that narrative, and it's why I think I come back to the narrative of growth, that's the narrative that is visibly showing itself now to be a false economy that we simply cannot afford a bill which racks up 268 billion every year and not look at feeding people properly, not looking at the industries that are tempting people away from decent nutrition, not looking at the industries that are profiting out of keeping people sick so that there are always a market for the pills that people want to sell. Now, I'm not against medication, and I think Sam would pick me up if I was. But I do feel as though the difficulty is that when we have focused our minds on the idea of growth, we're too willing to give away the goods. We're too willing to overlook the misplaced efforts of various industries that are driving us towards what is patently a false economy. And it does seem to me that that one key concept, that it is a false economy, is one that has the power to change the narrative, particularly with a Treasury that doesn't know where it's going to find its money from to do all the things that it wants to do. And we could talk about some of those things that it wants to do and whether they're the right things to do. But the point is, it, at the moment, is struggling to balance the books.
Yeah, I mean, Sam, if I could bring you in here, is that the kind of basis of social prescribing, the fact that it's the social environment that's creating chronic illness? Is that where the idea?
Yeah, just to pick up on some of the things Tim says, first of all, 60% of people in this country are overweight. Where I come from in Norway, it's 15%. If you're over 65, 10 to 20% of admissions to hospital are because of drug side effects. So it's exactly as you said, Tim. We have got a very serious problem. And the over-medicalisation of everybody has been a disaster. So I've been on the radio and TV in the last few days about the fact that we are the sick note capital of Europe too. And why has some of that happened? Well, the answer is we've medicalised everyone. So 1 in 5 adults in England, 1 in 4 in Scotland are on antidepressants. So it's exactly as you say. And yet there are very simple answers to this, which is what we do at Bromley by Bow, where I'm a GP, where we have 100 projects under one roof. We have art therapy, we have jobs advisors, we have educational courses, we have creativity and spirituality. Actually, we're a church, but we also have the Muslim festivals in the church, and where we're focusing on that 80% of people's health and well-being. I do agree with you about the pill. The problem is there's a pill for everything. And we also have an organisation called NICE, which isn't very nice, because actually it's driving that. And I often, at conferences, look at all the doctors and I say, you have to make a decision. Are you a healer or a drug dealer? And that's how serious it's got, how serious the problem is, and why the social prescribing is so important. And my final point on social prescribing is, you might ask why we called it that. It's a funny term, isn't it? I remember at a big meeting with all the heads of NHS England, including the chief medical officer at the time. He didn't like the word because it sounded like socialism. And then somebody from Public Health England didn't like it because it sounded too medical. And then I looked at that person, I said, I'm going to tell you a secret, but I don't want you to tell anybody else. And I said, we called it social prescribing because it's a secret conspiracy to re-educate all the doctors and nurses in the country without them knowing we're doing it. So, but don't tell them. But the problem is massive. And I was about to actually very quickly just ask you, so what makes you feel well?
Having kind of family and friendships.
Gardening.
A sense of purpose.
Dog walk.
Exercise.
And that says it all, doesn't it? Nobody mentioned drugs, medicine, money, or anything else. And how I always like to summarize it is around the fact that actually we've lost connection to in our society. And we have to my job as a GP is to reconnect people to their family, their community, and to nature. And if I can do that, I can bring back health. And you're entirely right, it's not about wealth. When I see I shop in the same, I live in social housing, I'm a leaseholder. I shop in the same shops as my patients in the East End, very deprived community. And actually, when you look at their trolleys, because, by the way, everyone argues, well, they can't afford to buy healthy food because calorie for calorie, guess what? Junk food is cheaper. But junk food isn't food. Ultra-processed food isn't food. And if you just look at their trolleys, you see what the food industry is doing, and it's getting them to fill up their trolleys with a whole raft of stuff that isn't food. And I could take the same money they spend and put healthy food on their table. So we have a very serious problem. It is and should be about health, and it should be about the wider determinants of health that I've talked about. And you've given me the answers, actually, in your response about what makes you well.
I mean, Tim, to go back to connectedness, the politics and economic discourse have become disconnected from the lived experience as well, right? Is that part of your purpose, is to give people a way to talk about care and health that doesn't put you outside the envelope?
Yeah, I mean, I think there are two difficulties there. There's two difficulties with my title. One is care and the other is economy. For slightly different reasons. So economy is always problematic because most people don't give a damn. They don't understand it. They don't want to understand it. There was this wonderful story about during Brexit when someone turned up to persuade the whole country that it was worth getting out of Europe, and if we didn't, then it would have a horrible impact on the GDP. And a woman in the crowd said, "That's your bloody GDP. It's not ours." There's a sort of a sense of disconnect from everyone in the economy. And one of the things that I've tried to do in all my writing really is to give people back access to economics, to the idea of the economy, because the economy should not be this set of opaque indicators that governments follow and someone in the bank might understand one day but probably doesn't understand the next day, and that everybody else just believes is for their best. Economics should actually be, I mean, its original meaning, sort of management of the household. How do we get by? How do we provision? What does the society look like? How do we make society work? And those questions have always been fundamental to prosperity without growth, to post-growth, and to the care economy. The care word, the problem with that is slightly different. So care has a sort of aura around it, and it's one of the things that I struggled with writing the book, is that care has a sort of sense that it's an unassailable moral good. But when you define something as an unassailable moral good, it's virtually useless to you in analytic terms. You can't do anything with it. You can claim it. You can claim the moral high ground by proving to someone that you care. But that care can take all sorts of forms which aren't necessarily caring or promoting of health. And one of the things I wanted to do in the book was to return the idea of care to something which we could think of as a dynamic, and the dynamic that actually it came to me on a Pembrokeshire beach late at night in the middle of winter when I was trying to write the book and getting very tied up in knots in it and watching the moon rise above the ocean, thinking, just suddenly popped into my head, does the moon care? Does the moon care? Does this inanimate thing sitting up there looking as though it might have a face in it, does it really care? And I'm not sort of talking about that in anthropomorphic terms. I began to think of it as a kind of a principle. What is it that the moon does, which could be construed as care? It's constant. Its attention is constant. Care and attention are intimately related to each other. But it does more than that. It restores balance. It is a process of a dynamic of restoring balance. It restores balance to the tides that those tidal movements allow for the coming in and the flowing out of water. In that interstitial region between the ocean and the land, we developed. We would not be here but for the constant attention of the moon. And so there was a kind of, it was a bit of a shock because it wasn't what I was thinking of, but it gave me an idea that I followed through the book, that actually care is neither a special sector of the economy subject to special pleading, nor an unassailable moral good. It is, in some sense, about the dynamic of restoring health. It's a restorative process. It's the dynamic that brings us back into balance. And that dynamic actually occurs at every level that we live at, the level of the moon and the planetary movements, the level of the wisdom of the body and our sense of bringing ourselves back into homeostasis, and indeed in those actions that we call care, because we integrate that sense of balance into performative tasks of nursing and doctoring and looking after each other and being a parent and being a carer. Those are tasks of care because they are restorative of health. Or to be more precise, they're tasks of care where they are restorative of health. And that's the same of almost anything you could think about in the care economy. It has to some extent, bring itself back to that idea that actually we're here subject to balance and not growth at all costs, not the idea of more and more, the idea of enough, the idea of health, the idea of connection, the idea of our families, the idea of our own physical ability, the idea of our interaction with other people, the idea of conviviality. These are all aspects of care because they are restorative of health in one kind and another. So that was my idea, was to kind of rescue both economics and care in one go. Now that I think of it, I think it's a little bit ambitious, but you can judge for yourself.
Can I introduce Mike? I can't introduce you because all I know is that everybody's very excited you're here. You're going to have to introduce yourself.
Well, thank you very much. I'm Michael Dixon, a victim described in this excellent book, actually, which is how we both met for the first time. And I'm a GP in Devon and have a slightly different view of medicine from some of my colleagues. I think Sam may have enunciated some of that already. And I'm chair of the College of Medicine, which believes in exploring what medicine can do beyond pills and procedures. What we can do through social prescribing, which I imagine Sam has described, but also all sorts of other ways. So in the college, for instance, the King, who's our patron, had this brainwave of saying, why don't you connect GP practices to farms? And we did that, and what was extraordinary was not only the benefit that patients in the practice had from contact with animals and farms, but also the extraordinary advantages that the farmers themselves had. Because you probably know, farmers have one of the highest suicide rates there is. They're lonely, they don't have many social interactions. And this has had the most extraordinary consequences. We've taken social prescribing into schools. You probably all know, but COVID has had this extraordinary, terrible effect upon our young people. And we asked our local school children what really would be the most important thing we could do to improve your lives. And most extraordinarily, they said the best thing we could have would be to have volunteering opportunities. And with a large elderly population who had not got to terms with IT, we just had to connect the elderly with the children, and off they went. But coming to Tim's book, I mean, this is, it's an extraordinary book, it really is, because we talk about growth the whole time. Growth has become the god, hasn't it, for economists, for developed countries. And yet, and I'm sure you've already described this, you know, the problem is that we are using up resources. We're often involving people becoming unemployed because machines are taking over their tasks. The planet is being increasingly threatened. We've got 20% of the population in this country on antidepressants, would you believe it? And so we're not in a great place. So is growth actually what we really want? Is growth making us happier? Is growth making us better in our health? The answer is it's not around us. Look at the ill health, the misery on the streets, and it says it all. And that's why we need a prophet to come along and to tell us there is a different way. And what I like about Tim's whole philosophy is he's not an anti. It's too easy to just be a protester on the side, not being very effective. He goes with the flow. He said, I think, Tim, maybe I'm paraphrasing, you say, you know, growth is not bad, but growth is bad if you exclude health, if you exclude people, if you exclude health and the things that really matter. And I think this is such an important message because we're at a time of such monumental change with leaders of all complexions doing some strange things. We need a little bit of sanity around, and I think that, Tim, you provide that sanity. So thank you so much. And can I say right away, so sorry I was late, but I had a rather VIP meeting before I came and I was unable to get away too early. But I'm so glad to be here at the launch of what I know, because I've read the first drafts, is a really, really brilliant book. Well done, Tim.
I'm going to come to the audience for the questions in a second, and just do one final question about. We've talked about this before, but what it is about care that economists find hard to measure, and how they can maybe wrap their heads around measuring it better.
Yeah, I mean, I think I'm trying to remember what I told you before.
Yeah, in case you contradict yourself.
I mean, I think that the essence of care, and I've sort of alluded to already, is attention. Attention takes time. Time is something that capitalism in particular tries to chase out of the product. You want as much from your workers as you can in each hour. You want as little time spent on it so that you can maximize your returns, your revenues, your profits. And that element of care is resistant to capitalism's arguments. You know, there are certain things where you could make the care system a little bit more efficient, but it is sort of beside the point. That efficiency is beside the point, because actually the real function, the real core of care is that ability to pay attention. That ability to pay attention takes time. Time is not something that you can squeeze out of it easily. And so what we have in the capitalist system is actually a system that selects out care. It selects out those time-consuming activities. And it selects in those things where it can cut costs, cut workers, rip stuff out of the ground and throw them into this society as soon and as quickly as possible, in the hope that they fall apart as fast as possible so that you can do it all over again and make more growth out of it. And the more I think about it, I mean, Michael, you said, growth, I'm not absolutely against growth. I'm not, in the same way that I'm not against sugar. A little bit of sugar actually is something that we have an evolutionary adaptation which designs us to seek out sugar. But we live in a system that constantly bombards us with sugar. In the environment of evolutionary adaptation, sugar was very scarce, and so we developed a whole physiology that makes sugar very, very attractive to us, and actually kept us going and kind of motivated us and gave us the strength and vitality to evolve. But we evolved into a species with an economic system which is simply predicated on more and more and more. And that predication of more and more, which includes sugar, of course, is now making us sick. And that's the point, I think, at which that sense of returning to balance, returning to care, returning care to a sense of health is a critical kind of opposition to the question, to the dysfunctionality of growth. I think I lost the question somewhere in the middle. What was the question again?
The question, it's fine, you did the question. The question, there were two prongs to it. One of them was it doesn't understand time.
Yeah,
and
so the time thing is really critical, and this fact that you've kind of devised an economic system which systematically selects out those things which take time is absolutely devastating. And what's wrong about it is that essentially it kind of prioritizes the careless economy, it punishes the care economy, and yet the careless economy would be nothing without the care economy. So it's like you're sitting on the tree and you're soaring off the branch and you realize, oh, shit, we're on this side of it, not that side of it. The whole thing's going to fall down. You need the care. The care economy is the foundation, even for the careless economy, even as the careless economy begins to undermine the care economy.
I mean, it does feel, and maybe this is a question for all or any of the three of you, that as though the careless economy and the care economy are uniquely pitted against each other right now. Between big food and big pharma, and between the cost of living crisis and the social determinants of ill health. It does feel that way.
I believe it is, and I believe it's worse than that, because I think that that careless economy has driven us to a path which has become political instability, which has become about power and dominion, which is now turning towards arms and armament, which is turning away from care and ripping money out of care, specifically so that it can rearm itself to create havoc, which is quite obviously violent and the absolute antithesis of care. So we are right up against it in that sense, and that confrontation between care and the careless economy is not just about big food and big pharma, it's actually about the military turn, which terrifies me. And it's one of the reasons why I think this is a conversation, and more than anything, I want it to be a conversation. I've already had some fantastic conversations, not least with Zoe and hopefully with some people here tonight. But I do think it's an absolutely vital conversation to have at a point in time when we are at a crossroads where care itself will be the first casualty.
Are there any questions? Yes. I'm going to bring you a mic, even though I think you'll be fine.
Thanks. Hi. I sort of wonder whether one of the great contracts of fossil fuel industries was the personal carbon footprint, like putting it back on individuals to try and escape from a fossil fuel dependent economy. So when consumer capitalism is the problem, consumerism, which I think is part of what you're probably going to unpack in this book, which I haven't read yet, how can consumers escape consumerism, or what's the actor that can, what's the off-ramp, Tim? How can we get out of this mess?
That's great.
Yes, it's possible the individual. I mean, let me just give you the part that there's a little bit of a case study in the middle of the book, which is obviously a n=1 case study, and it happens to involve me. But it was a part of my journey. At certain points in the writing of the book, I was diagnosed as being pre-diabetic and actually thought, well, this is easy, I'll get this licked. And, I went back 6 months later, had another test. Oh, no, you're full on diabetes now. You are. I'd gone in the wrong direction. And so why did I go in the wrong direction? Well, I didn't try that hard. I thought I could, cut out a little bit of sugar, and I did. And I thought that would fix it. But I didn't reckon with the reptile brain, which lives there and actually means that I'm addicted to sugar, and that I had to break that addiction. And I just would go out and find sugar in all sorts of places where I didn't even realize it existed because nobody really told me. And I was surrounded by this kind of sugar matrix. And that sugar matrix is why 1 in 3 people in the US is pre-diabetic. And it's why chronic disease is rising and rising and rising. It's why inflammation is incumbent across the population. It's why chronic disease accounts for something like 75% of the health budget. And so the point there is that you, as an individual, I tried and failed, and then later may temporarily have exceeded, who knows. But it's really, really hard work. And it's hard work because you're living in an environment in which that is not, we're not living inside a health matrix. We're living inside a growth matrix, and that growth matrix is destroying health from the inside out. And so yes is the answer. You can, as an individual, go back and find the place where you're not addicted to sugar, or you're not addicted to drugs, or you're not addicted to dopamine, or you're not addicted to overconsumption. But you can't, as a society, expect that to happen unless the structures of society themselves change. I'm one end of a bell curve where I had just about enough intention and not too much damage to make a little bit of a turnaround. But you can't expect that at the population level if you continue to build the change, the trap that is keeping people trapped. And so that, to me, is the argument. And, you know, it's not about individual change. It is absolutely about system change.
Hi, I was really hearing what you were saying earlier about people not being interested in the economy. And I work in the cultural sector, and I talk a lot about what's wrong with the economy in the talks that I do, and people recognise it. But I was talking to people recently about an exhibition in Manchester about the economy, and they said the people who loved the economy loved it, and most people didn't come. So how can we engage everybody in the idea of the economy? Have you got any ideas? Because I work in the cultural sector, and I'm really keen to find a way to harness the power of the cultural sector to kind of get us to think that there are alternatives for a start, and then what those alternatives might be. Because until most of the people think that it's possible to have an alternative, whatever happens, it won't meet with an enthusiastic response and won't get votes. So we need people to understand that it's possible to do something different, and getting people to understand the economy is at the root of that. So any ideas, welcome.
Yeah, I mean, I don't know, because I've spent my whole life doing it or trying to do it. I mean, I teach the kids in my class who come to the class without any economics, and I try and teach them economics. And the thing that always, absolutely excites me, makes me feel as though it's a task worth doing and brings me back to it, at least up to a certain point, is that when I've spent that time with them over the course of a week in understanding that economics is not something out there, it's not something dry, it's not about formulae or lines on the chart, it is actually about the way that we organise our lives for the well-being of people, and then engage them in that task. What I find is that by the end of the week, they can come up with solutions which would shame government departments, really, honestly. And you can do this almost reliably over and over again with different cohorts of people, that you can bring people to the point where they understand what it is about, even if they are consistently being expelled from the realm by language that they can't understand. And that, I think, is one of the ways of doing it, is refusing to die on the hill of economics and economic language, and rather arguing that this is something that belongs to people, and it belongs to us. In education, yes, perhaps in the creative arts, in theatre, in writing, hopefully in kind of the stuff that people like me write, but also in being able to approach that in ways that are as accessible. I was very taken with Sam's, asking those very simple questions and the answers he got back. That's economics in some sense, and it's also, of course, health, and it's also a medical prescription for social prescribing. It's all sorts of things, but actually expelling people from the discipline and the language of economics is a crime, it seems to me, and being able to rebel against that, I think, is really important.
Any more questions? Okay, you, and then you can mingle.
Thank you so much. I always wondered, ever since I knew you were writing this book, whether there's also a link between the care economy, as in care, restoring balance, restoring health, and care as in caring about something. So perhaps finding sources of meaning beyond what the capitalist growth economy allows us to find meaning in. So I wonder whether the care economy is also a proposal of an economy that has a broader basis of meaning or other sources of meaning then in a capitalist growth economy, and perhaps from the medical point of view, whether that is actually connected to health as well.
Yes, I mean, it clearly is connected to health, and Sam already, I think, kind of made that connection, that meaning is a part of what we seek in health. And I mean, in answer to your book, in answer to your question, did I do that in the book? What I did in the book, I think, is go to the point of understanding that actually the way that we pursue meaning really matters, and the way that we pursue meaning in the growth-based economy actually is deeply dysfunctional, and it's taking us away from care and away from health, and actually towards war and violence. It was a key part of my argument in the book. And that actually one of the reasons it does that is that the source of our desire for meaning is, of course, the ultimate fragility of our lives. That health, you can maintain health for a very long time, you can't maintain it forever. And that means that one day you're not going to be there, and that's deeply unsettling. And it's unsettling that you're not going to be there. It's unsettling that people that you love are not going to be there. It's unsettling the loss you experience on the way. And that is a part of what we have to bring within the orbit of care and think about in terms of health. And that's non-trivial, because we can go off from that position into two very, very different paths. One of them which is something that you could be called care, and the other which is really where the fear triggers a kind of terror management response, which is basically about getting personal power and dominion and empire and showing that you belong to the right tribe and creating division and ultimately creating violence. So that question of care and violence was really critical for me through the book, and the place where it came together most, and the place where ultimately I think I at least sort of stumbled on a kind of resolution that I was happy with for now, was exactly in that idea of how we create meaning and whether it is or isn't caring.
I get the last question. Tim, I was wondering if maybe the food economy could be the point of revolt against the uncaring economy, because of all the bits of the economy, it's the bit where we have a certain amount of empowerment. You know, you can grow a carrot and eat it, you can cook it and so forth. And you look at all other areas of the economy and, you know, that's so much out of our control, you know, the big machines, big, you know, et cetera, et cetera. And you know, food has so much resonance on different about caring, about relationships, about culture, about bringing people together, et cetera, et cetera. And, you know, maybe with the UPF and the beginning understanding, food could be the point of revolution. Yeah.
I'm going to let Linda answer that, because she is the architect of the food revolution that I personally had to undergo.
She doesn't want the microphone, but I'm going to give it to her.
She doesn't necessarily want the microphone, but she does deserve a lot of the credit. I absolutely feel that's right, Henry. You know, it is a place where you can make your own choices. It is a place where you can develop different habits. It's a place where people should be revolting, because food, or what passes as food, is revolting. And actually, you know, that is kind of a place where the thing that's stopping at the moment, and it is very powerful, is a lobby from big food in particular, which has the narrative that poor people can't afford to eat healthy food, which is, you know, ultimately wrong, because the hidden costs of what they are eating are enormous, not just for the exchequer, for the public purse, for the health system, but actually for those people as well. So that narrative I find absolutely horrendous. It's a narrative which is trying to say to people, you deserve to eat shit because you can't afford to eat differently, because we need you to eat the food that we're providing for you, because that feeds the big food industry, because that underlies growth. And that is a horrendous narrative, and it's completely wrong. And I would like to see your food revolution, Henry, very much. And I can assure you that it's possible at a personal level to engage in it slightly. With the help of Linda.
It's going to be a collective revolution.
Well, the revolution has to have some power behind it. Yeah, it has to have some of that, but you can at least become a revolution.
I think this is so important, what we're talking about at the moment, because, yes, there are the grains of change. We all go to Tesco and Amazon and hate them, but I come from Devon, Truro, you know, where everyone's got different coloured hair, and where they didn't let Starbucks or any of the coffee companies come. And I think the trick is going to be some national policy to to redress the inequalities that power and growth have made. But the real revolution is going to be at community level. One of the things we're doing in the college is creating, you probably know there's a food strategy, which was abandoned, then a white paper, which was abandoned, then an equalities strategy was abandoned, and then having announced we were going to somehow overcome this establishment plot, which Tim demonstrates so well, to make sure that those that have the least eat the least healthy food, and therefore not only have unhealthy lives, but ramp up health service costs and create all the vicious circles we talk about. But it is possible to change it, and we've in the college we're producing these Eat Well communities that have been abandoned by the government, starting in Cambridge and also in Burnley, where people die earlier than anywhere else in the country. And the trick we're finding is to get everyone on board, to get the local council, to get the local schools, to get the farmers and the voluntary sector, and really just revolt. And say of this we will no longer put, and I think it is possible, but I think it does require a very large roots revolution. It requires leaders like Tim to fire us all to do that, and I think it requires courage and a belief that it's possible, because I think amongst our young people, some people feel they simply can't challenge these things.
Right, are you ready to mingle?
Yeah, yeah.
Have you got a final word?
Well, just some thanks to a few people. Thanks to Jonathan for kicking it off. Thanks to Louise, who was my commissioning editor at Polity Press. Thanks to you all for coming. Thanks, Zoe. Thank you, Sam and Michael. That was a wonderful tour de force, and thank you for being here against the odds. Thank you to my team in CUSP, who are the ones bringing round drinks and canapes. And finally, thanks, of course, to Linda, who is not just the architect of my dietary revolution, but also my partner and the person with whom I had the conversations that I needed to turn this book into something that you might like to read. Thank you.